Receive a request. There we go.
Yes, recording in progress.
Okay, we're recording.
Okie dokie.
Okay.
So what is the question?
What happened?
Let's see. The question.
I did. How groups work for individuals with substance use issues? And also, what challenges do you see with utilizing groups? Those are the two questions I think that we should answer.
Okay.
Hold on a second.
I took some copious notes, so I'll be happy to go first.
All right.
Perfect.
For the
Your
first
copious
question-
notes, initial reactions.
Yes. So I will want to do the first question first all the way around and then the
Sure.
second one? Okay. So I just thought that I believe that group counseling is effective for individuals with substance use disorders because it fosters a sense of hope and optimism, and that seeing others in the group making progress and achieving their goals can support and inspire other individuals in the group to find and believe their own ability to change. Group members can serve as role models for one another, just displaying that recovery is possible and that living substance-free is within reach.
Mhm.
This sense of hope can be a powerful motivator for individuals to continue working towards their recovery goals. And even when they're faced with challenges and setbacks, I think the support of the group can be very powerful. In addition to providing emotional support and inspiration, group counseling can offer practical tools and strategies for managing substance use disorder. Evidence-based treatments such as cognitive behavioral therapy or motivational interviewing may help individuals to identify triggers for their substance use and support them in developing healthy coping skills. I think that group members can also share their strategies for staying healthy and provide a valuable insight and support to each other through their sharing in the group. Group counseling can help individuals develop a sense of personal responsibility and empowerment in their recovery journey. I can't speak. So overall, I believe that group counseling is valuable and an effective approach for therapy, and by offering a comprehensive and holistic approach to recovery that addresses physical, emotional, social, and some psychological aspects of the substance use issue, that it can be a powerful tool for individuals to break free from the cycle of substance use disorders.
Okay.
That's what
I
I got.
agree.
I agree.
I do too. I agree.
Yeah, the things I found interesting was one, just the economy of groups versus individual kind of therapy, that there's the ability to group resources around one professional in a group, and so that has added value. The other thing I found interesting, which is different than like 12-step groups, is the ability to confront individuals within the group using the dynamics of the group, which I thought was really interesting and really leans towards the need for a trained professional to be able to do that in a way that doesn't create, a mess or hurts more than it helps. But yeah, I agree with the other things that Patricia said around the benefits of groups.
I want to expound on what Patricia was talking about, and it's through the reading that we had to do. And I highlighted some of the stuff. And what was positive for me was that groups provide positive peer support. That was one. And it reduces the sense of isolation, and it enables people who abuse substances to witness the recovery of others. I thought that was profound too. And then there's another thing it said, it's the diversity that plays a high role in group therapy. You know, you have all these people from all these different backgrounds, and you're only thinking, you know, because sometimes when it's substance abuse, you think of it's only in your social economic background. That is not true. It happens with everybody. I think that I'm gonna say back in the day, I'm not gonna give you a year, but it seemed like when substance abuse was on the rise, everybody knew somebody in their family that had a drug problem at one point. You know, so you don't have to feel like you're isolated, because if you're able to get into a group, you know that you're not the only one that's trying to recover from this situation. So
Mhm.
those are some of the things I thought that with groups. So yeah, that's one thing.
Well, some of the things, well, I agree with everything you all have said, but excuse me, I have the same um feeling about what the benefits of a group are. You know, it offers support. You're amongst your peers. You all, and the group members all have the same goal, is to, you know, stay sober. And another thing about the group that about groups that I really like is that it teaches social skills. Because like the executive of the Tip 41, that part when they discussed, you know, it depends on where the client is at in recovery. And a lot of times they don't have the social skills, you know, and they don't have impulse control.
Mhm.
And I think that's another aspect of being in a group offers. You learn social skills because if you've been abusing substances, a lot of times the person that's abusing the substance does not have great social skills. Um, they don't interact well with others, except for the people that they, you know, that have the same issue with, as they are having, which is, you know, abusing substances. However, I think if someone that's abusing substances is within a group, eventually they learn those social skills and they learn the impulse control. And if they're around their peers, you know, that's extra support as far as, you know, using and, you know, learning how to interact with others. So yeah, I had the same, same feelings, and I agree with what everyone else says.
I really appreciate that. Just that maybe among peers, people are going to be more understanding and able to kind of go with the
Mhm.
flow as someone emerges and grows in their interpersonal skill set and learning boundaries. Maybe a little bit more forgiving than, you know, their aunt
Mhm.
during Thanksgiving.
Exactly. So yeah.
I thought when Dolores said that we all know somebody who struggles with substance use disorder, and I think we're all in this field probably because of that, our own personal or our family members' personal lived
Right.
experience. And I just
Hmm.
remember when I first started working with women, and I worked with a lot of women who struggled with heroin use. And I remember people would say to me, how do you work with those people? How do you work with those women? And I would respond, those women are our mothers, our daughters, our sisters, our friends, our classmates, our pastors. And they would stop and look at me like, what? And I'm like, yeah. I go, if you can't honestly say that someone you know or love has been touched by substance abuse, that you need to open your eyes.
Yeah,
So
for sure.
that was just a little bit of that. And then Lee, when you said something that was interesting about how the group dynamic and how we can have someone who's been in recovery for, 25 years, and then someone who's
Yes.
been for 25 days. And I think meeting, getting that group together that we can learn from one another, or the group can learn from one another, and we can hopefully
Mhm.
facilitate it.
Definitely,
Well,
definitely.
I'm sorry to cut you off. You know, to some extent, in a group, we have levels of emotional intelligence. You know, like some people really need to figure out how to self-regulate. Some people
Mhm.
really need to know, like Leah said, social skills. And then some people need help with their self-awareness, because when you own substances, I think that I'm gonna give you an example. Say, for instance, you started out at 15 years old and you're hanging around with those people, you're not growing intelligently. I mean, you're not growing. You understand what I'm saying?
Yes, yes.
It just stops. So you may be in your brain like 15 years old, but yet you 21. You know?
Exactly.
Yeah, because you are not emotionally, I don't know if I should say emotional intelligence, but you just stop growing.
Yeah, you
Yeah,
lack the development.
Yes,
exactly.
like development.
Yeah, because you know what? It seems as though whenever the person started, with whatever age the person started abusing substances, it's it's as though they've stayed at that age mentally.
Right,
Yeah.
right.
So I agree. I totally agree. I think because in my experience, I have met people that were abusing substances, and I would often wonder, well, they seem like they're still a teenager, but they're adults.
Yeah, yeah,
And then I thought about it. I said, it seems as though whenever they started abusing the substances, it's like their brain just, stopped at that point developing. They stopped developing the social skills, interpersonal skills, impulse control.
yeah, yeah. I had a class, but it's been so long ago, and they talked about the effects of drugs on your brain, especially with young people, and how it stops something in your brain. I can't remember exactly what it is, but
Mhm.
yeah, you do stop developing because some, you know, serotonin or dopamine or something in your brain is going haywire. So, yeah,
Yeah.
yep, it happens.
Hmm.
So the second question is, what challenges do you see with utilizing groups?
Oh, well, the challenges I would see would be encountering a group member that has relapsed but presents as though they're not abusing substances, because it's almost as like, of course it depends on how long they've been using, because you've heard of functional alcoholics, functional substance abusers, and they can mirror like they haven't been using, but eventually down the line their behavior or the way they're interacting, can bring about, can display that they've been using, and you could tell that they've been using, but they're trying to present as though they haven't. And they'll come in acting normal, but eventually during the group session, impulse control, they get angry or upset or agitated, or they those are their actions. So so you would know the signs of relapse, of course, but they're trying to present like they haven't been using. So that would be an issue for me.
Yeah, people are complicated.
And
Yeah, and very crafty, by the way.
Yep.
Yes, very crafty.
I think to speak to that, Lee, like, I think another thing would be like managing the group's dynamic and conflicts that may arise with someone who
Mhm.
is coming in and using and not being, forthright about that. And that maybe it's common for people in recovery to have interpersonal issues and conflicts with other group members.
Mm-hmm. Mm-hmm. I could see that. Yep,
I
I
guess
agree.
that could disrupt the group. So I guess it would be important to address the conflicts like right away within the group and not allow it to fester and be carried on for week to week.
Yes,
Trying to
I
make-
totally agree.
I
The
think
other- Oh, sorry. Go ahead.
I think one thing that would be challenging is trust. You know that we say that this group is going to, you know, have confidentiality, but still in the back of your mind, what is your threshold of Trust. I think each individual is different. So,
Mhm.
you know,
Yeah, good.
people may not say it, but I believe it's there. And I believe, how do you present to your group as a professional that you're trustworthy? I mean, young people look at trust different than older people. People that's been in recovery longer look at it different. Maybe some of the issues in your past may have you, taking a while to trust an individual. Like
Mhm.
that. Humans are complicated.
Mhm.
Mhm. I agree.
No, how do you deal with trust in a group? I don't know. I think that's one thing that may be challenging for any group.
Yeah,
I
I
think
agree.
like I wrote down like that would require like starting out and setting ground rules for communication and behaviors within the group to ensure that everyone can participate and benefit from the group experience while respecting one another. We kind of talked about that last week too.
We
Mhm.
did. We did.
Mhm.
But like Ron has said, people are complicated.
They
So
are.
there's still that, mm, you
Yeah,
know,
and there's a connection between trauma and abuse and addiction. And
yeah,
so, trust is the pathway to sobriety.
yeah,
But if you've been beat up a few times, boy, it's hard to trust.
yeah,
And
yeah.
Mhm. Mhm. I agree.
Not to be a Debbie Downer, but that
Mm.
was what I was thinking about. How do
yeah,
you go in there and, you know, maybe you done did some wild things. Now we have, what do you call it, where we have to report things, but that's something you would have to say and to
right. Mandated reporter.
mandate it. Right.
Mhm.
That's just some of the rules when you first come into, you know, the group and so forth. But I really think trust would be something that, you know, would have its moments with the group facilitator, whether you pull off to the side or,
Yeah.
just saying things inside the group. Yeah.
I think the challenge I thought a lot about is the level of training that the professional needs. In the tip, it just talked about the leader requires a vast amount of specialized knowledge and skills. And so versus a peer-led group, um, therapeutic group, kind of requires somebody with a high skill set. And my experience has been that, some people who lead, these kinds of groups don't necessarily have the skill sets to make it as successful as it might be. And so just acknowledging the reality, boy, this takes real training to do well and to do in a way that's beneficial to those involved. So I think
Wasn't
that's
it
a challenge.
shocking in Corey in chapter 2 that we had to read the list of the things like that were involved as a facilitator?
Yeah.
I was kind of like, oh yeah, no.
Yeah, I think I'll have to see somebody do it a few times.
Yeah, there
Yeah.
was a lot. It was a lot. I was like, oh, wow, there was a lot on that page. I think another thing that I thought about was that like that we might have people in the group that have underlying mental health issues or like depression or anxiety, and like having to, as a trained professional, like you just said, Ron, being able to, you know, understand what's going on in their life and in their with them, and to try and navigate that through the group. I think this is probably difficult.
Yeah, for sure.
Yeah.
Boy, I'd love to see somebody, you know, I don't think I've been in a lot of peer-led groups, but I don't think I've ever been except maybe years ago in a, you know, in a therapeutic led group. I'd be really interested to see it done.
Yeah, I would like to I've had the experience of um working alongside therapists that have had some type of therapeutic group. Um, but what I noticed was that there was a difference between the therapeutic group, well, at the time, there was a difference between the therapeutic group and the skills management group, whereas the skills management group had lots of substance abusers in there. And it did take a while for them to gain my trust as being involved with the group. So eventually, you know, they were okay with me being there after a few sessions. But yeah, trust is a really, really big thing. A really, really big thing. And I think it helps if the group facilitator um just not so much as the because my thing was I was concerned about the educational background, but I also believe that the group facilitators would have to use hmm, I guess you would call it street smarts to be able to pick up on certain things, because even if you have the educational background, you would still have to have some level of knowing what to look for with the substance abusers. Because, like I said, they present one that sometimes, depending on what they're using, what drugs they're using, and how long they've been on the substances, they present very well, very well. So, yeah.
I think that I don't know if you're always able to do it, but to have a seasoned facilitator as well as a co-facilitator until you
Yes.
able to, you know, understand the dynamics of the entire group is a,
Mm,
you know,
I agree.
Yeah,
I totally agree.
I'd like that for sure.
but I don't know if that's always true and you're able to do that. But
I do think that, yeah. Oh, go ahead. Sorry.
no, I thought about
Yeah.
I would need a seasoned facilitator, and I'm her co-pilot or his co-pilot, so that I can, you know, get a sense of what's going on, the lingo in the group, the street stuff that people be talking about, all of that stuff, you know.
Mm,
And then I'd be able to ask the facilitator, well, you know, I heard this. Well, what do you think of that? And not make sure, but hopefully I'm on the right page in my thought process as to understanding the group. You understand?
mhm.
Like,
Hmm.
Yeah, I totally agree.
yeah.
Mm-hmm. Yes.
I think one or two other things that I garnered from Corey's reading was the burden of attempting to keep a group alive if you have no support from the participants. Like all of us are talkers, I think, and we're ready to engage. But can you imagine trying to facilitate a group where no one is speaking and they're all just, you know, sitting there?
Looking at you,
Yeah,
sitting there.
so he suggests that let's see, too little self-disclosure or too much self-disclosure, wrong thing. Okay, the burden of attempting to keep the group alive with little or no support from participants. Corey suggests that disclosing how you feel and how you are affected by this lack of motivation is very useful and appropriate. I thought that that was important.
It's very important.
It's
Yeah.
good.
I agree. Yes, very important.
So what do you do behind that, Patricia?
Well,
What do you?
Well, like I think he said, I feel like I would say, I feel that, that you're not engaging or that we're not engaging, and he just said it's very useful and appropriate to share how you feel and how you're affected. So I guess I would just say, I feel like we're not making progress today, or not as much as we were in our previous meeting. And does someone want to share something? The other thing he said too was like to start the meeting by giving each individual an opportunity to speak and to see what is on their mind, and see if you could come up with a common thread, and then make that be the goal of your group, which I thought that was interesting too.
True.
There's just
Well, I have to. Oh, I'm sorry. Go ahead. Well, but I have to
said there's so much.
Yeah, that's okay. But I have to admit what I have done for groups is I always give them goodies, like little snacks or little drinks, and that usually warms everybody up because they know they're gonna get, a snack, and then they come back. Hate to say it, but that was one of the
Yeah.
things that I would do, because people would come to the groups and they'd be like, oh yeah, okay. And then some of it is mandated by the court, so they really don't want to be there. So I would get them like little treats. I would have like little bags of chips, little bottles of water, you know. And then eventually,
Hospitality. Yeah.
yes, and eventually they would warm up and, you know, come back and, talk and stuff. Because sometimes you do get that where people are reluctant to talk, they don't want to be bothered, they're being forced to come in. And I said, well, what can I do to help this? Because I was working alongside of a therapist once, and that was her complaint, that the people were not opening up. And so I was like, what makes people talk? Food is always a good thing to bring people together. So
Universal.
that's what I started.
Yeah.
And
Just
the hospitality, and then Patricia, just the whole idea of reflecting feelings and having that be the starting point versus, so why do you guys think we're not, sharing today what's going on, and seeing if that gives people an on-ramp, and, so using the silence as a way to find another opportunity to get people moving, I think is done well.
That's good. That's
Well,
good.
you guys, we answered the questions and we're at about 30 minutes. So I think we're good unless anyone has any. We're A+ group here.
Want me to read my
Yay.
closing statements for our closing of our thing?
Yes.
By
Sure.
implementing evidence-based strategies and techniques, we can help support and empower group members on their journey. We must be empathic, knowledgeable, and adaptable in our approach to facilitating groups for substance use disorders in order to create a safe and supportive environment where individuals can heal and grow. Mic drop.
sounds great. Yay.
Okay,
Like
everybody.
church.
That's right.
Yeah. Well, thank you all so much.
I hope you all have a great Sunday and a great week.
Yeah,
Thank
thanks,
you. And the
guys.
same to you all.
Again, I'm
Mhm.
really thankful for this group. I think this is a better way to learn than just reading, So thank
I
you.
agree.
Thank you. And thank you, Ron, for posting our group.
Yes, hopefully it all goes perfectly.
All
Okay.
right. See
Well,
y'all
thank
next
you.
week.
All right.
Bye,
All
guys.
righty. Have a good week.
All right.
Bye-bye.